Doctors have read it. What was a symptom a patient didn't mention that was really important? Story 1. I'm an EMS worker and one day my 62-year-old neighbor calls me up and tells me to bring my blood pressure thingy. She's a retired cop and one of the coolest persons you could ever hope to meet. She's also stubborn as a mule. So I'm thinking immediately that if she's asking me for a once-over, things are not swell. So I head up with my cuff and stethoscope and ask her what's up. She tells me she's felt off for a few days, dizzy at odd times and exhausted. I take her blood pressure, she's sitting in her chair. It's fairly normal, but she's still acting off. Her eyes are red-rimmed. She's pale and then I notice a bruise on her chin. I ask her about it. She tells me after getting up to go to the bathroom the night before, and the last thing she recalled was walking back to her bedroom. She woke up later on the floor. In my world, that's just cause for a ride in our Weep-Whoop mobile. But again, we're not dealing with your average little old lady, so I'm essentially now trying to convince her gently that she needs a doctor's opinion. I did a quick test to rule out stroke, and she passed with flying colors. I do a postural, where someone goes from sitting to standing and you check their blood pressure to see if they're compensating. And she's down a solid 20 points, but is of course playing it down as not a big deal. As we're negotiating, I tell her, look, you wouldn't call me up here for nothing, so we need to figure this out. Then it finally comes out she's had dark and tarry stools and vomit. Well, that was the end of negotiation. Ambulance was called and she was rushed to the ER where she was immediately given a blood transfusion because of a massive GI bleed. I'm still surprised her BP was within normal ranges both times, but I've chalked it up to the amount of piss and vinegar she has in her. Weep-Whoop mobile is my new favorite word. Hilarious. Glad he managed to get her checked out. Hopefully she's doing alright. Story 2. Exhaustion. Not just being really tired at the end of the day, but unable to function type of exhaustion. I would wake up in the morning and then 2 hours later need to take a nap that would sometimes last until 3 or 5 in the afternoon. I told my doctor and she ran blood tests, thinking it was my thyroid, but nothing came back abnormal. I was 29 years old. She kind of shrugged and figured it was hormones. A few months later, I noticed rectal bleeding. Went back to the doctor to be told it was hemorrhoids and just waited it out. Turns out it was stage 3 rectal cancer. I was cancer-free for almost 3 years until it reappeared in my lung. Now I'm stage 4 and about to begin immunotherapy. I'm lucky because my disease is relegated to only a tiny spot, and I have a rare mutation that qualifies me for immunotherapy, but it's still an absolutely terrifying situation. Feeling extremely tired all the time is one of the first noticeable symptoms of some cancers. Please don't let your doctors ignore it. Story 3. I'm not a doctor, but I can tell a story as a patient. Ever since I can remember, I had a purple fingernail. Not like blood under the nail, but the fingernail actually grew purple. Happened after an injury when I was a little kid. I had doctors look at it all my life. They all said it was weird and that they couldn't really explain it, but that it wasn't an issue. When I was 19 years old and getting a physical before college, I went to a new doctor in the city I was moving to, and she pointed it out. I said something like, "Oh, I've had that since I was a kid. Other doctors never could figure out why it grows that color." I could tell she was actually concerned. She referred me to a dermatologist, and sure enough, they said it was quite fishy. Could have been an indication for some kind of, and forgive me, I'm not a doctor, but some kind of melanoma or skin cancer. They took a biopsy, turned out to look sketchy. They sent me to a skin cancer specialist. The results came back extremely abnormal, but not cancer. They ended up amputating the purple part of my finger, and it all turned out fine. I don't know exactly how this stuff works, but I'm so glad she caught it. Now you can catch me in the dermatologist office every 6 months getting checked for irregular pigments. By the way, their theory was that it was a mole that got crushed and the pigment got spread throughout my finger, or something like that. I had a friend with a purple toenail. It wasn't always there. He had it after he told us to run the car over his foot. Good times. Good times. Story 4. Chest pain. Guy denied ever having chest pain, ever. Told us he was able to chop wood and work on his land without any issues. He didn't meet any criteria for additional work prior to surgery. During his major surgery, he had a huge heart attack. A cardiac cath showed that he basically had one very narrow coronary artery that was the only thing getting blood to his heart. His daughters, who were nurses, all swore up and down that he was healthy as a horse and never complained of heart issues. Then his other daughter, who was a black sheep, arrived and said he actually had told her that he had terrible exertional chest pain every time he did anything. But that he didn't want his other daughters to know because they would worry. He died a few days later. If we had known about his symptoms, he would have likely had his cardiac disease diagnosed and treated prior to surgery. It's important to know that women and people with diabetes may not have the classic symptoms of cardiac chest pain. The American Heart Association summarizes some of these differences. Hey, also, if you didn't know yet, me and a couple of my friends just launched Rufus Rugs. Premium, custom, hand-tufted rugs. Maybe you're just a fan of Naruto and want to show it off. Or maybe you just love Pokemon and want bus toys on display for everyone. Either way, we can make almost anything. So hit the first link in the description to learn more. Story 5. Saw a patient during follow-up for a gynecological cancer. She said she felt great. The exam was normal. She was relieved, but she was so anxious it set off my medical spider sense, so to speak. I decided to push a bit further, which led to this conversation. Me. So you said you felt good. Absolutely nothing else bothering you? Her. Oh, some small things. Nothing having anything to do with this. Me. Well, why don't you tell me anyway? Her. Well, I kind of have this weird lump on my belly, a sweat gland or a greasy nodule or something. Doesn't really bother me, but I might get a dermatologist to have a look at it if it ever needs to be removed. Me. Ah, I see. Could you show it to me? She showed me, and I saw skin metastasis, clear as day. Don't know how the story ended because I moved to a different service immediately after, but if I had to guess, her life expectancy was probably measured in months. Story 6. I'm a doctor. These stories are from a few years ago when I saw patients. I'm a medical intern working the ED. Dude comes in with a heart attack. That part's clear as day. Gonna be medically managed procedure in the morning. I'm about to queue up some nitro paste. It's a cream you put on skin that helps get blood flow to the heart, as my resident had seen him first and said it was okay. And I went through the contraindications as it was just habit at this point. One of them is recent sildenafil use. Patient had said no to recent sildenafil use to my resident when his wife was there. He said yes to me when I asked when his wife wasn't there. He wasn't using it with his wife. Nitro paste was avoided, blood pressure stayed okay. The coronary got stented in the morning, and he was discharged the next day. Pro tip. While you toss the family out to do the rectal exam, ask all the questions they want to answer honestly. Also, while I was working the ED, a lady came in with a seizure or loss of consciousness. She's about 45. We're probably going to watch her overnight. She's been prescribed tramadol before. I ask how much she takes. She's a nurse. She tells me what the prescription says. I do my usual, ever take double or half? What works for you? As a means to get people to be honest. She's nervous. While these things can bother people with seizures, I say. She's more nervous. I then try the, look, I don't give a crap, just lay it on me and we'll unpack it approach. She's taking 12 at a time, 4 to 6 times a day. She was about an hour late with the pills and seized. If I remember right, clearing 3 to 4 grams of tramadol per day. People are getting intoxicated on 0.05 to 0.2 grams. She's doing a gram every few hours. I called the resident. Resident calls the pharmacy, I call poison control. We figure out a med dosing that would probably kill someone but is enough to cause her to not withdraw. She lived. I was pretty impressed that we titrated that down over the days she was in the hospital. Better do one more. This one isn't as serious, but it's a good story. Young woman, outpatient clinic, has headaches, onset 4 weeks before. Okay, I go through the whole physical exam, a good history, everything. Not really a migraine, but her head hurts every evening. Anything makes it better? No, just sleep. Sleep's enough, regular schedule, which is unheard of in folks with headaches. At some point I just give up and ask what she does for fun. She plays this video game. Oh, that's cool. Online and stuff. That's how I learned that she sat 14 inches from a computer screen 80 hours a week. She followed up a while out and said that she was still competitive in the game, was ranked quite high, playing 60 hours a week on summer break while taking breaks during the day. This is the best advice. Send the family out of the room for real questions. Also, what game is she playing? Maybe we can team up and she can carry me. Story 7. Not a people doctor, but I worked as a vet tech for 3 years. Had a little tiny mini shih tzu in horrible health with a nasty attitude to match. You could seriously barely touch the dog. She was very, very sick. The only reason we were able to do anything for her was because she was so small. Owner comes to visit her one afternoon and casually mentions to us that she's deaf. Poor thing was scared out of her mind and did remarkably better once we learned to let her know that we were there before touching her. I don't know about you guys, but I think tiny dogs are the feistiest. I was once walking a large pit bull and a chihuahua. You'd be surprised to learn which one actually tried to rip my leg off. Let's just say the pit bull was only looking for belly rubs. Story 8. Medical intern here. Had a woman come to the ER complaining about stomach pain. Took her full history, did the exam and vitals. She seemed fine, mild fever. Made a preliminary diagnosis of gastroenteritis and presented it to my doctor. My doctor, who is female, goes to her and asks why she came to the ER for something so mild. She says because she noticed blood in her stool. The doc comes out and asks me if I asked about her stool. I did. She said it was fine. And I asked specifically about blood. She goes back in and asks the patient why she didn't mention that to me. Her response, didn't think it was appropriate to say it to a male intern. Turns out she had ulcerative colitis, needed a colonoscopy and long-term medical therapy, and possibly surgery. Story 9. If you're a middle-aged gentleman and you have cardiac risk factors, diabetes, overweight, etc., and you develop ED, you should tell your doctor, as there is some evidence that is an early symptom of heart disease, possibly preceding a heart attack or stroke by 3 to 5 years. Far better to get on statins and blood pressure medication than just ignoring it, or taking sildenafil by yourself. You can tell if it's a circulatory cause as opposed to psychological if you stop getting morning wood and have difficulty maintaining or achieving a chubby in your alone fun time. A GP told me this during my primary care rotation. Med student here. I assume she told me this for my learning and not that she thought I was likely an impotent chubby dude. This is just a general PSA if you like, but see your own doctor if you're worried, not least to get willy issues sorted, which are no fun for anyone. I remember a comment once from a Redditor saying that high blood pressure was a good thing because higher pressure equals harder wiener. People tried to convince him otherwise, but he wouldn't listen. Also, did you know it's scientifically proven that if you hit the like button and subscribe to the channel, you get a bigger wiener? Go, try it out. I know you want to. Okay, back to the videos. Story 10. As a primary care doctor, we try to keep to our tight schedules. It can be difficult when patients could come in with something complex or with a shopping list of things they want to talk about, and balancing this with providing good care and being mindful that the next patient will be waiting in 15 minutes for their appointment. We can be notorious for being late for these reasons. I saw a patient the other day who said he had a runny nose. I just got on with it, made sure she didn't have any signs of a more serious illness, and gave her some advice on what to do. After that, she also had a pain in her ankle she quickly wanted checked out. I couldn't find much wrong and assured her it would probably be okay in a couple of days. Now her 15 minutes are up and I'm kind of gesturing to her that we're finished. Then she pauses and says, "Okay, I just wanted to get those things checked out. The main reason I'm here is that I've been having chest pain all morning." God, I face-palmed. Talk about beating around the bush. "Oh, my nose is running and my ankle hurts. Is that all? And oh yeah, I've been having chest pains." I don't know about you guys, but this is hilarious. Story 11. Always damn unintentional weight loss. Takes me from, okay, not too bad, to, oh crap. Unintentional weight loss is losing more than 5% of your usual body weight in 6 to 12 months. Your doctor should work through the possibilities step by step, starting with most common to least common. A CT scan is usually not the right first or second answer. You should be getting age-appropriate cancer screening, PAPs, colonoscopy, mammo, testicular exam, prostate exam, and bring a detailed family history of cancer to your doc, including type of cancer, when it was diagnosed, and what stage it was diagnosed in. Make a diary of your symptoms, including things like night sweats, mood changes, diet, swollen glands, blood or changes in stool, etc. Story 12. Admitted a baby in my intern year that had transferred to our facility for persistent vomiting following a surgery on a part of the intestinal tract. The transferring facility had wanted us to start the baby on a form of intravenous nutrition and offhandedly mentioned some low-grade laboratory abnormalities that they had attributed to the baby just having had surgery. I go into the room in the middle of the night, the first representative of our medical team to meet the family, and in the process of gathering the history, ask the family what color the baby's poop was. The family replied that it was white or gray and had been since birth, that they just thought that was how it should be. Record scratch. Big red flag. We ultimately diagnosed the baby with a rare genetic disorder that required an organ transplant. To address some recurring themes, no, it was not biliary atresia, though that should be at the top of the list in anyone's mind when a baby has acolic stools, since the chances of success of the surgical correction of biliary atresia decrease the older a baby is. As for a pediatric liver transplant, I'm by no means an expert, but the donor pool is typically the same. They just harvest a smaller portion of the liver so that they aren't putting a huge organ into a tiny baby. And as for the outcome, I've kept up with this family, if only peripherally, over the years, and the child is doing well. I'm reasonably well past my residency training, and this was early on in my first year of training. Wow, this just sends chills up my spine, and I'm one who isn't easily shocked. I'm surprised that the other hospital didn't catch that, but I'm glad y'all did. Happy to hear your child is doing well too. Story 13. I once was rounding on a patient in the morning that had come in for a stroke. I decided to ask some basic review system questions just out of habit, and when I asked about changes in vision, he said yes. I probed further, and he told me that he was using eye drops for something, but that he forgot his eye drops at home 3 days ago when he came to the hospital. For the last 3 days, the vision in his left eye was worsening along with eye pain and pressure. When I called his pharmacy to see what drops he was using, as I suspected, they were for glaucoma, and he was having worsening vision loss due to untreated glaucoma increasing his intraocular pressure. We got an ophthalmology consult stat. It blows my mind that people can be so nonchalant about their health. Like, I get a minor skin infection from a scratch and a hike, and you bet I have a Google Calendar reminder and am applying that topical antibiotic to the prescribed minute, even though I know it's not even that important. Story 14. Did my sub-I in a level 1 trauma ED a few years ago as a 4th-year med student. Homeless guy with Hep B, and HIV came in talking about a rash on his shoulder, how it hurt, had been pretty hot out, and that was where he was slinging his bag on. Looked okay. Figured it was a sweat rash. It was really there for food. So I was going to give him some cream and a sandwich and send him out the door. Was about to leave when I looked at his chief complaint again, and it also had testicular pain. So I asked him what was going on with his nuts. Lifts up the gown and he has a tracking abscess through his crotch skin and through one of his nuts. It did not look good. Trust me. Oh, it's okay, I guess. Ended up calling urology and infectious disease, and the guy ended up leaving against medical advice because we were making him NPO, without food, in anticipation of surgery. Story 15. Not a doctor, but something I hadn't considered would be an issue. I had shortness of breath and chalked it up to a somewhat rare condition called hemolytic anemia that I'd had before but had been corrected with heavy doses of prednisone. I called my GP and he scheduled a lab, but my levels came back normal. It kept getting worse, so I finally went to the doctor. They did a chest x-ray and said it looked like I had two-lobe pneumonia, which was rare for someone my age. At this point, there were probably 3 doctors in the room asking questions, including my own. My doctor then said that because I have lupus, I'm at risk of developing blood clots and wanted to know if I'd experienced any unexplained swelling. Well, yes, actually. My right leg below the knee had been slightly swollen for weeks. Turned out I'd had a pulmonary embolism and was lucky to be alive. Also, my doctor is a genius, and it's definitely the reason I'm still alive. Story 16. Medic here. Ran a call to a general sick person and arrived to find a slender lady in her 80s. She wasn't feeling well, and her granddaughter finally called 911. We run through our assessment and aren't finding too much to go on. And then, me. Anything happened recently? Like a fall or a trip or something like that? Her. Well, I fell a few days ago and hit my head, but I wasn't feeling bad until a couple hours ago. Me. Oh, okay. And you took all your meds since the fall? Her. Well, no, I didn't take them yesterday, just today. Me. This morning, like usual? Her. Well, no, I took them about 2 hours ago. Screech sound. Me. Including the blood thinner? Oh, snikes. They yelled to the other FFs to grab the gurney. I didn't even need her to answer. I knew exactly what was happening the second she told me she took her meds right before she started feeling off. Subdural bleed. Didn't even matter how fast we drove, and we drove fast. She lost consciousness shortly after we got to the ER and probably never regained it. The blood thinner accelerated the bleed and she expired from it. It was such a terrible situation. Her granddaughter was really confused and scared at the sudden shift in our demeanor. It was such a large bleed. A textbook case presentation that it was used as a case study for quality improvement training. Story 17. Not a doctor and not even about me. But this is just too interesting of a story for me not to post it here. So my dad was a bit of a slow child. Always forgetful, got bad grades, needed to have a list of everything important with him all the time to avoid forgetting it. In his 20s, he gets an allergy test done for no real particular reason beyond having it recommended to him by his doctor. Turns out he's lactose intolerant. Of course, he tells the doc that the test clearly failed because he's never had a bad reaction to milk in his life. Are you forgetful? Turns out the lactose just makes him forgetful. The doctor he'd visited happened to have done research specifically into that type of lactose intolerance. He cut dairy from his diet and suddenly all the problems went away. To this day, I've never met anyone else that even knows that this can happen. That is really interesting. Who would have thought dairy had an effect on that? Guess it's time to cut back on cereal for breakfast. Wait, no. I need Cinnamon Toast Crunch. Cinnamon Toast Crunch. Story 18. I'm not a doctor. My dad was cooking and sweating and was getting out of breath around 6 p.m. He was 50 years old. We ate dinner and went to bed. He stayed all night with chest pain because he didn't want to wake my mom up. He finally decides to wake her up at 4 a.m. She's a nurse. She calls an ambulance because she knows the signs. The paramedics get there and do an EKG. My dad is laughing and goofing off with the firefighters. My dad refused the ambulance since he was no longer actively having a heart attack. He took a shower. Got a cup of coffee and around 7 a.m., my mom finally gets him to the ER on the threat of divorce. He was immediately taken to the cath lab and had to be resuscitated twice. I didn't find out until 11. He was just getting out of surgery. His surgeon, Dr. N's first words to me was, "He's okay, but I've never been more scared." He mentioned that he almost crapped himself. He's still my favorite person on this planet, and Dr. N's dad is now my dad's primary doc. My dad now carries nitro. If someone is having a heart attack, you should call 911, and then check their key set for a medicine container. Nitro can save a life. Funny how men always act okay but are on the verge of dying. Needed to be threatened with divorce just to get him to the hospital. Hilarious. And also, it's called a weep-whoop mobile, not an ambulance. I hope you enjoyed the video. If you made it this far, I'm sure you're like, psychologists, what caught you off guard? Story 6 was my favorite. Catch you on that one.